Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, 888-630-9625. That's how you find me. Love to talk to you on any subject you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, here's an opportunity to put the real light on the subject so you can fix it. Health is a do-it-yourself program. Anything that happens to you is, as long as you're breathing, is reversible, at least to a place where your body can begin to change over a period of time. Depends on the length of time you have left on this planet, but you can be better than where you are right now. So let's talk about those issues. Let's figure out what we can do to help you. That's why we're here, and that's why we do this program every Sunday at 12 noon at a very, very perfect time. Forget some of you coming, some of you going, some of you going out, some of you staying in. So, but nevertheless, 888-630-9625. Let's talk about some of the things that are more important to you while we're waiting to take on your issues. We have several topics today I want to talk about. And before I get to that, by the way, I want to remind you that this last Wednesday evening, Dr. Pino was supposed to have a program at our office at the Roselle Center for Healing on East versus West anatomy, meaning the integration of East and West concepts as it talks about energetics and what that really means to the hard components of your body. So if you have a muscle pain, why does that really happen, and what does it mean from traditional Chinese medicine? So it's a class that is power-packed. Well, here's the deal. Because of the snow last week, we canceled the program. So you have another opportunity to attend, and if you missed last week for registration, give us a call, 703-698-7117. That's 703-698-7117. Tell my staff you'd like to attend. Dr. Pino will be doing the presentation this Wednesday, the 13th, and all you need to do is call us and make a reservation. As you know, these in-house continuing education programs are our gift to the community, and there's no cost to you. All you have to do is register. That's the cost. You got to pick up the phone, you got to register, you got to tell us you're coming so we can make sure that we have enough room for everybody. Before we get into the program today, well, I want to talk to you a little bit about pain and what type of pain. Is it fibromyalgia pain? Is it myofasciitis pain? Is it headache? What is it, and how can you identify it? We're going to kind of differentiate that a little bit for you. But there's a lot of things in nutritional news, and I want to go through some of these things and make sure that you understand that you have the capacity to change a whole lot of things. We get a lot of guys that are coming in, and if you talk to traditional medical physicians, they'll tell you, pretty much 75 to 80% of all guys, if they live long enough, are going to have prostate cancer. I sit there and I listen to those statistics and I say, really? Everybody has to. That's just life. That's the way it is. And if you talk to certain allopathic physicians, they're going to say, yeah, that's just the way it is. Well, nothing is just the way it is. You have the capacity to turn anything around, no matter what it is. There was an interesting study that was just published in the American Journal of Clinical Nutrition. And the research was done by a group of Swedish scientists who investigated the association between sugar-sweetened beverage consumption and prostate cancer in a whole bunch of guys, about 9,000 people, over an extended time frame, around 15 years. And the outcome was very, very interesting. What they found in this interview, and there was the primary interviewer was Isabel Drake, and we had mentioned a little bit about this a few weeks back, but here's the deal. As much as one soda a day, just one, and this is why I wanted to bring it back up to you, one soda a day is enough to increase your risk of prostate cancer significantly, up to the neighborhood of around 45 to 50%. One. So if you're going to whatever fast food place you're going to, or you're going to, the corner store and you're getting a Coke or you're getting a soda, or you're getting got to think twice, because there's ramifications for that addiction. Besides the weight, besides the neurological problems, besides the phosphoric acid that causes debilitation, deterioration, there is a risk. And in my opinion, my humble opinion, some of you say, well, not so humble, nevertheless, it causes problems. So think about it twice. The data's there. You can look up the research. It's important that you understand that you can do things differently in your life. There's a diagnostic test, and what we're talking about is something that has to do with arthritis and the causative underlying reactions. There was an article that was published in the American Journal of Epidemiology, and they did a test and monitored by something called CRP, or C-reactive protein, which is an inflammatory marker. It shows you how much inflammation is in the joint space. And they did a study with glucosamine, chondroitin, and or fish oils, and they tried to see if they could reduce the inflammatory markers in the body as it related to coronary or C-reactive protein. So these researchers studied, again, guys, you were the study subjects, of almost 10,000 people, and the researchers at a very, very prestigious place called the Fred Hutchinson Cancer Center analyzed all this data, and they in both there were some women in addition to the study, and they participated in the National Health and Nutrition Examination Survey. And what they ultimately found was the relationship between diet and the onset of joint space degeneration. And they saw that people who used fish oils, people who had chondroitin in their diets, people who had glucosamine in their diets, had a significant reduction in arthritic pain and inflammatory and destructive lesions of the joint. 17% with those who use glucosamines, and 22% with people who use fish oils, and 16% with patients who used a combination of things, in addition to the already reduced levels. This is significant, but what it really came down to is that they saw that people with diets that were high in refined foods, people who had toxin in their body, people who had high levels of inflammatory reaction, remember we said inflammation equals acid, are going to suffer from increased rates of degeneration. So what they wanted to see, without changing the diets, could the addition of these things make a difference? And what they saw was, in fact, it could. If you know me, I'm going to tell you that diet, exercise, and mental well-being are the primary key components to turning anything around. You must take control of your health. In my book, Ageless Health, Health is a Do-It-Yourself program, you're going to find very, very specific how-tos. It's going to take you through. It's a treatise. It takes you through as a manual would, that if you pay attention to certain things, you can get certain responses in the body. You have the absolute control of things. Do you ever think about why things are happening more today? One of my lectures that I gave just recently, I said the sperm count of a male in today's society who is in his early 30s, young men shouldn't have any problem, is less than a man who was 60 years old in the 1950s. That's huge. That should make you stop and say, oh my God, something is taking place. Well, it is. What's taking place is a change in life habits. We don't do the things that we used to do relative to exercise and activity levels. We don't get the same nutrition from our foods because everything is fast food, everything is GMO modified, everything is, changed in ways that our bodies can't metabolize or process them. So when we look at the overall playing field, we realize that we are, in fact, doing it to ourselves, that we're causing our problems, that we're breaking down slowly but assuredly to the place where we're setting up a whole new vista of conditions, and we keep running into the doc for symptom resolution instead of trying to find out the why is that, the cause behind the problem. You have to find the cause. If you don't find the cause, you can't fix anything. You're only putting out fires. And the more fires that you put out, what you end up with is a slow burn underneath. You're not changing the circumstances that lit the problem to begin with. So you have to take control of things. So, yeah, you can fix these things with glucosamine and chondroitin, and not fix them, but you can make them better. You can decrease the inflammatory reaction. But if you keep shoveling the same old garbage in your body all the time, if you keep getting a lifestyle that is not productive, you don't get out and exercise the way you're supposed to, how do you expect to change anything? If you're a push-button reactor, that means that everything that goes on in your life you're reacting to, you're judging, those things are hateful. There was a woman by the name of Louise Hay. The Hay Foundation is an amazing organization, and she was one of the first people out there to talk about the emotional side of healing, and that what you feed yourself, the self-talk that you have, ultimately deteriorates and breaks you down. People who are, for example, hateful and vengeful, they end up with the tumors and the cancers and the degeneration. Now, not every one of you are going to have that, but we know that those types of emotions will trigger those types of reactions within the body. People who are rigid, unyielding, not willing to bend, they have the rigidity diseases like the arthritis and those kinds of degenerative conditions. So think about the structural, chemical, emotional as you move forward, because as I've said repetitively, those are the only three things that can cause anything, and to ignore things that are available to you is the first step in taking control and managing your life. We're going to get back into the news items a little bit later, but I want to remind you, 888-630-9625. That's 888-630-9625. Give me a call. I'd love to talk to you. We're going to talk a little bit about pain patterns today and what that really means. And if you have any pain, or if, I'm becoming a pain, give me a call. We'll talk about that. We'll see how we can deal with it. For the last 20 years, since it's been longer than, it's 25 years, 1988, the rheumatoid associations have come up with this diagnostic complex called fibromyalgia. And when you take the word apart, fibro means connective tissue, myalgia just means pain. Mya means muscle, myalgia, pain, so connective tissue of the muscle, pain. Now, it seems to be more of a widespread disorder and often encountered in practices like mine that deal with chiropractic and acupuncture and so forth, because we see a lot of people who are in pain all the time. But nevertheless, that pain pattern has an origin. There is a reason for it. The patient often presents with something called a non-traumatic type of presentation, means there was no injury. And you dig back. Have you ever been hurt? Have you ever taken a fall? Have you ever hit your head on something? But we don't dig deep enough. And one of the considering situations in many of these things is temporomandibular joint dysfunction, TMD. And that's, when you open and close your mouth, that hinge on the side of your face, that, if it's not hitting a vertical dimension adequately, can set up a cascade of inflammatory events and pain patterns throughout the body that can cause unremitted pain. It just doesn't go away, but it causes more and more problems. But is that the pain pattern, or is fibromyalgia something other than that? Well, the American College of Rheumatology says that you have to have 11 out of 18 different trigger point areas. Well, we specialize in an area called applied kinesiology, means the relationship of different muscle function in different parts of the body. So if we look at that, or we look at organ-muscle connections, we find that some of these muscles relate to very specific organ levels. And so we have a lead, if you will, going back to this. So what we want to do is we want to unravel headache pains and fibro pains and all of that. See, fibromyalgia, I'll give you a little tidbit, has to be with you a minimum of 3 months with pain that doesn't go away. It's there all the time. Nothing stops it. It's there. You have to have 11 out of these 18 trigger points. There is an interruption of a sleep pattern. There are very, very specific criteria that you have to have check marks after to make this thing what it is. But we're going to talk about some of the diagnostic impressions, and we're going to talk a little bit about more about things that are in the news today, because there's a couple items out there that I don't want you to kind of skim by and miss, because they're super important. But we're coming up for a break. Some very, very important messages and our sponsors. But we're going to get intense today. Give me a call, 888-630-9625. See you later. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's 888-630. We're here at 9625 to take your calls and answer your questions and give you the data and the information that you need to have. We're going to be welcoming a new station out of Richmond, 990 AM coming up, and we're going to be glad to have them online. Dr. Tom Roselle is going to be expanding this year and syndicating out. Love to hear from all of you, so make sure that you listen weekly and pass on that we're here. Go to drtomroselle.com, by the way, drtomroselle.com, and check out the website. Go to our web store. There's tremendous amount of, wow, I didn't know about this type of products there. And plus you can find my book there or on Google. Make sure you have a copy of it. It's important because it's an easy read and it's a very straightforward how-to-do type of book. And you can get also, not only that, you can download it to your iPad. You can buy the audio version so you can pop it in your car. You can do all kinds of things with it. So check it out, drtomroselle.com. And the website is structured so you can do some interactive learning. All of our old in-house continuing education lectures are there, and we rent them to you so you can sit in front for a day and watch the lectures at very inexpensive cost to you. And, 2 or 3 of you can sit around and watch it and get educated. Now, the new ones aren't there. You got to come to the office. You got to come to the Roselle Center, to hear the docs and talk to them interactively. But you can go back and repeat the lecture anytime that you'd like to. Let's go to the phones. Maria, calling from Vienna. How can I help you? Thank you for calling.
Yes, hi. Hi, Dr. Roselle.
Hello, my friend.
We're among those that listen to you regularly. We learn a lot.
Thank you.
There's been, for many years, my husband has had this dizzy feeling when he stood up. So now he got official diagnosis of orthostatic hypotension.
Okay.
Their doctors are saying he needs to eat more salt, drink fluids, wear compression socks. And now one of them wants him to take fludrocortisone.
Yeah, no. So let me tell you what that's all about. We've got about 4 minutes before I got a break for news. So I'm going to tell you what orthostatic hypotension is. That means you get up, you get dizzy, or you get up and you fall down. And you do it sometimes just turning your head or moving around too quickly. There's an organ system in your body called the adrenal glands. They're small little ductless glands that sit on top of the kidneys. And they put out a lot of different hormones. But one of them they put out is something called angiotensin. Angio meaning blood vessel, tensin, tension, put tone in the artery. And so when you change postures, this organ is supposed to kick the stuff out and give a little bit of a tweak or a squeeze to the arterial system so the blood doesn't drop out. And that stops that dizziness. That stops that orthostatic hypotension type of problem. It's usually a result of all kinds of injury or stress patterns or bad diet. And it's usually a combination of things over a period of years. We see it in our office all the time. And you have to make dietary corrections. If you're going to use salt, do not use table salt, you use sea salt. Make sure he's getting a lot of water, but more importantly, make sure that he's eating enough protein every day, and not pork and not dairy, but something about every 2 to 3 hours, small amounts, grazing, not a lot of carbohydrates, get the sugars out of the diet. And, so every once in a while he's eating some organic nuts, 3 or 4 or 5 nuts. He's getting a hard-boiled egg, an organic egg. He's getting a little an ounce or 2 of roasted chicken. And then he sits down with his meal with a lot of vegetables. The mineralization has to be balanced within the body. But it can be also something that is also contributory to the upper portion of the neck, the first 2 vertebrae in the skull. Those areas control a lot of the downward signals to the lower portion of the body. So there's multiple pieces to this, but if you do just that, the things that I told you to do, it will be helpful to you. Again, we see patients like this on an ongoing basis, and they can be turned around completely.
And this medicine, side effects to that? He's not too crazy.
Oh, huge side effects to any steroid, any cortisone, because it's going to further suppress the function of the adrenal glands. So if he does come off of that, then what happens, it makes the problem even worse. It's a rebound phenomena. Mm-hmm. So I wouldn't do that. I mean, you give somebody a call who does our work, or we're happy to check him out, but it can be fixed.
Oh, well, thank you so much.
Maria, you're welcome. Thank you for calling. Appreciate it. Levi, how can I help you, sir?
Yes, I'm on my right foot. At the bottom, I have a burning sometime. It just started in the last few months. And on top of my foot there, a little pain. Now, I know I have a touching bone on my knee, but it seems like I'm going okay with that. I have arthritis, I know. But I was just wondering what my problem is with that.
It could be a lot of different things. When you get a burning of the foot, you have to rule out one of two things. You either have to rule out a nerve compression, or you have to rule out a blood supply problem. So those two things have to be evaluated. The nerve root can be pinched either in your low back, it can be pinched in the knee, and you're not going to feel pain locally. You're going to feel it over a more general distribution into the foot or into the calf and so forth. If it's a blood supply problem, the burning will be there, but also you may have numbness or coldness, or you're going to notice that your feet are going to turn bluish when they're exposed to cold. So the differential diagnosis is based on the evaluation of those things. What can cause that? Bones that are out of place. There's two bones in the lower portion of the leg, the tibia and the fibula. If they're not anchored properly underneath or at the knee point, if they're not anchored at the foot point properly, then they're going to twist slightly, just a small torquing. It can be your talus, the bone in your foot that's out of position. Give us a call, Levi. If I can help you in any way, more than happy to do that. We're coming up to the news and some very important information from our sponsors, people that allow Dr. Tom Roselle Live to come to you. We'll be right back.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle web store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle web store on Amazon.com today. Visit drtomroselle.com and click on Roselle web store. That's drtomroselle.com and click on Roselle web store.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live, reminding all women to conduct monthly and annual breast exams. Also consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram, and it's safe and non-invasive. For more information, call 888-485-7736 or visit thermographycenters.com. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. Love to hear from you. Let's talk about what you want to talk about today. We have a whole bunch of potpourri things that I'm covering. We're talking a little bit about fibromyalgia and chronic pain patterns and headaches. We're going to get more in depth in that. And several things that are in the news which are important that I want you to know about. It's very important that you understand that health is a do-it-yourself program. Then you can make a point of taking control of your life, your health, making changes, doing things that perhaps you even haven't thought about. Wouldn't that be nice? Wouldn't that be nice to realize that you're not stuck, that you can do something differently? There was another interesting piece of data that I'd like to share with you, and it came from the Journal of Nutrition in 2013, January, a couple months ago. God, a couple months ago, before that far into the year. Anyway, it was talking about calcium supplementation increases fat loss in obese and overweight young adults. And I found that interesting because they don't tell the whole story relative to what we know. And it went on to say that calcium supplementation, and vitamin D were essential or beneficial, I guess, as they put it, in reducing body fat of overweight and obese college students. And this research was done, by the way, in China. And the trial it wasn't a big trial number. It was like 50 men and, maybe the equal amounts of women. And they did a body mass index, means your BMR, how much fat that you've got in your body compared to how much muscle mass and so forth. And the only people they took into the study were people that had 24% fat or more. So they were divided into randomized groups, and they were supplemented in their diet with 600 milligrams of elemental calcium and 125 units of D3. Or they didn't give them anything for a period of 12 weeks. 125 units of vitamin D is nothing, but this is an interesting study. So they saw that the amount of weight loss by both groups was similar. So I said, okay, so what's the deal here? But a significantly greater reduction in fat mass, and this is what they were trying to point out, that fat mass, the amount of fat that you actually lost, not the weight that you lost, but the fat that you lost, was greater in people who took calcium and vitamin D supplementation. So what's the underlying reason why? The why is. That's the thing that bugs me all the time. Why is that? And the why is that has to do with a lot of different things. Calcium by itself, unopposed with magnesium, causes muscles to tighten. They actually, if you didn't have any magnesium in your body, you would go into spasm. So you have to put magnesium into the body to balance the calcium. So they're only talking about vitamin D and calcium by itself with no additional magnesium. So that has to put more in my brain. This is Dr. Tom Roselle talking, okay? This is me, not them. That means that the muscles would contract. When muscles contract, you increase the heat, you increase the burn, you increase the metabolism, so you're going to burn fat. Now, there's a side effect. If you put too much calcium in the body, then you can go into heart fibrillation, you can go into heart failure, there's a tremendous amount of side effects. Now, that happens at a higher level. But nevertheless, unopposed calcium is not a good thing. And it can cause a whole list of other types of problems. So when we start seeing these things, these great findings in the news, these nutritional findings, you have to be careful. You really have to look at why is that. So if you're going to take calcium, first of all, we know today that people don't need as much calcium as we thought 15, 20, 30 years ago. That men probably need an additional supplementation of maybe 200 milligrams of calcium a day. Not a whole lot, maybe 3. And women, not as much as we used to think. At 1,800 milligrams, they can probably get away with 1,000. But it's the combination of things. It's the calcium with the magnesium, with the vitamin D, with a little bit of boron, with a little strontium, good digestive action within the intestinal tract, good alkalinity within the body that keeps the calcium in place. Those are the things that we need to worry about more so than how much we're getting into. But here's a study that is singling calcium out as this thing that's going to stoke the engine, if you will, and make matters a whole lot better for you. Well, when you see stuff like this, realize that the studies sometimes are very limited and that you have to look behind the scenes and find out what it's really saying. 888-630-9625, 888-630-9625. Love to talk to you on any subject that you have in mind. Take a tour, drtomroselle.com, DRTOMROSELLE. That's a website that we are continuing to upgrade and make better and interactive, and one that you can get educated on. Lots of data there. And follow me on Facebook as well. Go to Roselle Center for Healing, or I think you can find it even Dr. Tom Roselle, but I blog there and I put all kinds of data up. And if you'd like to talk to me offline, or you'd like to talk to one of my doctors, you can always do that by 703-698-7117. By the way, that's the number that if you'd like to attend Dr. Stephanie Pina's presentation this week, Wednesday the 13th, on the comparison between East and West anatomies, which he's calling it, but what it is why do you have that headache when nothing happened, when that headache goes behind your eye, when the acupuncture channel for gallbladder starts at your eye, goes around the back of your head and all the way down to your foot? Why does the big toe throb when you have gout and it gets hot and it gets inflamed? And we know that gout has to do with liver function. Well, the acupuncture channel for the liver starts on the big toe. There are a lot of reasons, and all of a sudden you get that, aha, I got it. Well, this is an opportunity to get that aha experience. Call us at 703-698-7117. Tell my staff that you'd like to attend, and you'll be our guest, and Dr. Stephanie will be your host. Talking about pain patterns, and you can talk about anything else you'd like at 888-630-9625. Managing fibro pain, fibromyalgia. We talk about fibromyalgia as being this all-encompassing, never goes away, oh my God, I'm going to die with it type of pain. Well, the problem is that there is a why is that behind that, and this pain pattern generally is more female than male, but it hits guys as well. And it has to do with the persistency of pain. We said that it has to hang around for at least 3 months, doesn't go away, doesn't break up. It has to have 11 out of 18 trigger points present. That means if you touch it with 4 pounds of pressure, and that's the rule, it's 4 pounds of pressure over these trigger points, you're going to say, ouch, it hurts. It's not in the joint space. That's another differential situation. So if you got arthritic pain, knee pain, ankle pain, it's not fibro pain. If you have this glaring headache that just doesn't go away, it's an all-over type of headache, it's not fibro pain. It has to affect all 4 quadrants of the body. That means it has to affect the upper portion of the body, right and left, lower portion of the body, right and left, for it to be a true fibro type of pain. Those are the rules. I didn't make them up. I'm giving you exactly what the American College of Rheumatology says that this is. It's classified as a rheumatic autoimmune condition. I'm not sure that autoimmune is the right tag, but that's the way they classify it. And that it's, as we said, all 4 quadrants of the body, and it has to be around and so forth. Interesting set of statistics that 90% of fibro patients have jaw and facial tenderness. Isn't that interesting? 90%. And this is when I first started treating fibro patients. I saw that, but I really didn't get it until the last several years. TMJ, temporomandibular joint, we talked about, the TMD, if it's not in a normal vertical position, can cause all kinds of problems, including fatigue and that stiffness that doesn't let go, and depression and recurrent headaches. It can cause the lymph nodes to swell. It can cause bowel bladder problems. It can cause anxiety reactions and dizziness, and it goes on. But 90% of these patients, 90%, according to this one very significant study, says that it has a little bit of an association, not a little bit, but seems to be a lot, with temporomandibular joint dysfunction. So how does that happen? Where did these people get that from? Well, sometimes it's just nothing more than bad dentistry. And if it's bad dentistry, then you got to get the mouth fixed. You got to get the vertical dimension in the mouth fixed. See, dentists sometimes when they put fillings and crowns and caps and all those things in, they cut the height short. And then everything shifts around it. Because when you're sedated, you're numb, and they go zip, 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 and they say, how does it feel? You say, good, because you can't feel anything anyway. Then when you come out of it and it's just not hitting the right way, you put up with it, and then everything begins to shift. Let's go to the phones. Ruth, how can I help you? Thank you for calling.
Yes, I've developed tinnitus, and I'm just wondering what the cause might be and what's the solution.
How long ago did you come up with the ringing in
Probably
ears?
about 6 months.
Okay, I'm going to ask you a couple quick differentiating questions. Is it a high tone, or is it a low tone, or does it sound like crickets?
Crickets.
Okay, so it's not a normal type of tinnitus pattern that most people would categorize. A high tone, I'm going to differentiate them for you. A high tone squeal is usually a liver problem. A low tone problem or a droning type of sound is kidney function. The cricket sound that you're getting is often an upper neck problem and or an allergy reaction that's causing problems within the cochlea, the inner ear, and eustachian tube closure and opening and so forth. So that's not 100% across the board, but that's one of those things. So can it be fixed? Yes. You have to identify which one it is. If it's the cricket sound, then you have to look at the mechanics of the ear and the neurological network that goes to the ear, the placement of the first and second cervical vertebrae, and any type of allergy reaction that ensues. We treat that on an ongoing basis. We see a lot of patients, unfortunately, with that type type of problem. If it was a high-pitched sound, you got to detoxify the liver, and you give certain things like niacin, which seems to help dramatically. If it's a kidney problem, sometimes something as simple as drinking enough water and getting the things that dehydrate you out of the body can be effective. So there's multiple pieces of the puzzle, but the short answer is you probably very definitely can be helped. Love to help you, Ruth. Give us a call if we can be of use to you. Thank you for your phone call.
Thank you.
888-630-9625. Give us a call. I'd love to talk to you on anything that you have in mind. We're talking about some interesting factoids today, if you will, and kind of differentiating the pattern of pain and whether you have headache pain or face pain or all over body pain. It's important that when you tag something, and unfortunately there's too many false diagnoses that are out there. We think that pain just is, and a lot of doctors, because they want to get paid for a procedure, they want to get paid, they put a diagnosis in that they know they're going to get paid for, but really doesn't mean anything. And with the next onset of Obamacare, which is going to hit in 2014, when everybody's going to have to be up and running, every doctor is going to have access to your records once they all go online. They're going to be able to see. So it's incumbent, it's important that things be put down accurately, if nothing more than a description of the area. Pain patterns, is it a fibromyalgia pattern or is it a myofascial pain pattern? Two different things. Is it a facial head myofascial pain presentation, or is it a nerve root that's being compressed? Is it a temporomandibular joint dysfunction, or is it a referred pain pattern from an acupuncture point that goes to the face? The more we understand the why behind certain things, the more that we can get to the root and fix the cause. If you don't fix the cause, you have nothing. You're treating symptoms. Even if you go to a wellness practitioner like our office or somebody that does our work, we still have to find out what's triggering this thing. And then we need you to step up to the plate, to help us, to work as a partner, as a team, to change the things that took place that brought you to that place to begin with. For example, if we know that you're having neurological problems, meaning that you're starting to have memory losses, or that you can't focus, or you start reading something and you're off into another time zone, that sort of thing. And it doesn't have anything to do with an emotional distraction that you happen to be in at that time. Well, the intestinal tract produces the majority of all of your brain neurotransmitters. GABA, serotonin, dopamine, to mention a few. And if the gut isn't working, if the intestinal tract's not working, if it's inflamed, if it's irritated, if it's got bad bugs in there, if it's what we call permeable, where you're absorbing foods before they're fully digested, then these substances cannot be produced at the levels that you need them, so your body starts getting crazy. If your blood sugars are off, you're going to have a problem where you're going to bounce up and down emotionally. You need to change those things. We're going to talk a little bit more about pain patterns when we come back, but right now it's necessary that you listen to our sponsors, so don't go away. Every Sunday we're here, and I'm trying to continue to give you updated information to provoke you, to tweak you, to make you do your own homework. That's why we do what we do at Dr. Tom Roselle Live. We'll be right back. Welcome back. This is Dr. Tom Roselle. We're at 888-630-9625, bringing you the most important information that you won't find anyplace else except for right here. Remember, I said my job is to tweak you, is to make you think, is to make you question anybody and everybody that gives you any data, including me, and to get you not only into the web, but to go buy books and compare the data. There is no one way for anything. There are many ways, and the more you know, the more you understand, the more you get down to basics of how you run your life, the things that you put in your body, the things that you do to strengthen your body, the movement that you get. It's an ongoing process. Remember why they call it the practice of medicine. Simply because they don't have the answers. And the most effective medical diagnosis is 50% accurate. So when we look at things, we try to ask the question, why is that? How come things are taking place? This Wednesday evening, Dr. Stephanie Pina, one of the most able and incisive people in our practice, Dr. Pina is a doctor of naturopathy as well as an acupuncturist, is going to bring you insights into Eastern Western medicine. She's going to be talking about Eastern Western anatomy. And what that really means is how you begin to differentiate an elbow pain from being muscular and an elbow pain being energetic, and why these things kind of hang together like a hand in glove. It's really fascinating. It's going to be an exciting evening, and I would encourage you that if you'd like to know more, another piece that you can add to your puzzle, give us a call at 703-698-7117, 703-698-7117, and tell my staff that you'd like to attend Dr. Pina's presentation this Wednesday evening, the 13th. Love to have you as our guest. Love to have you see our practice. Love to answer your questions in any way that we can be of use to you. Please let us know. Go to drtomroselle.com, drtomroselle, and check it out. Go to the website and see what we can do relative to providing you not only with products but information and so forth. We're here. We're trying to continue to upgrade. We have a lot doing this year. There's a lot of things that are going to happen. We're going to let you know as they go on. I've been coerced by my staff that I will be the guy that's going to get questioned on the microphone within a few weeks. And if I back off, they're going to really have at me. So it's going to be interesting. Actually, we're going to talk about China. We're going to talk about what I saw when I went over there last spring and the different types of treatment processes that are there that we don't have here. It's amazing to me. It's just absolutely one of those things that blow your mind if you didn't see it, even with the experience that I've had over a period of many years. When you don't know what you don't know, and then you see what it was that you don't know, it just opens up a brand new paradigm, something that totally will rock you. It's incredible. Next week, we will be welcoming WLEE 990 out of Richmond, AM, as part of the Dr. Tom Roselle family of stations. We're going to be adding more this year. We're excited. We can't wait to get our message out and our information out to as many of you, because my mission is to help as many of you as possible, to change your lives, to give you the tools, to allow you to have the power to be in a position where you can beat all odds. Because the truth of it is that you're supposed to be living life to the fullest. You're supposed to be, it's not about positive thinking. It's not about anything other than giving you a game plan, knowing that as long as you're breathing, that you can do something about your health, knowing that you can change anything, no matter what it is, for the better. From simple things like headaches and allergy reactions to things that are far worse and far more disabling. I'll be here next week, promptly at 12 noon, giving you more information, more data, and a guest as well. See you then. Be well. Dr. Tom.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.